Hi, and welcome to another episode of Harley Street Health. Today, I'm delighted to be joined by Dr. Lee Ser Yee, who is a consultant general surgeon, along with a specialist in hepatopancreatobiliary surgery, who's just started here at Mount Elizabeth Orchard. His clinic's called Surgical Associates, and he originally came from SGH, where he was a specialist, and now, nice to see you. How are you?
Hi, Michael.
What do you want to talk about today?
Okay, I thought it is good to talk a little bit about a very common condition called gallstones, and maybe I can share a little bit more information on that.
Yeah, perfect. That's perfect. Gallstones are obviously super common, and I guess maybe why don't we start with what symptoms people get from gallstones and what they've got to look out for?
Okay, so gallstones actually present quite commonly with abdominal discomfort, a feeling of bloatedness, indigestion, and sometimes if the complication occurs, depending on what the gallstones block, it can be fever, severe pain on the right side, especially on the right upper abdomen, and also even presenting with jaundice sometimes, fever and chills.
Okay, and so what type of age group what type of person is going to get this? Who should be looking out for these kind of symptoms?
Oh, that's a good question. So gallstones are quite common actually. They occur up to 20 to 30% of the general population. Most people would get their gallstones or may start feeling symptoms when they are 30, 40 years and above. So the common rules of thumb for patients who have gallstones are the 5F, so to speak. The fat or the obese people, maybe BMI more than 30, associated with some hyperlipidemia or high cholesterol levels. It's more prevalent in females and also in fertile females, most probably due to the higher estrogen levels. They tend to disrupt or imbalance the cholesterol levels in the bowel. As mentioned, anyone above the age of 40s are generally at higher risk. And also there's a trend in family members who have gallstones. They also tend to be at higher risk.
All right, so maybe partly genetic.
Yeah, I think there is an element of that, no doubt.
And I think maybe let's take a step back, because I'm pretty sure a lot of people don't know what the gallbladder is and why we have gallstones in the first place. So sure. What's it for, the gallbladder?
Okay, so maybe I take another step back. So what I do is I do hepatopancreatobiliary surgery, and to many in public, this may seem like a very long and foreign term. Essentially, simply, we are the specialists that manage the diseases in the liver, pancreas, and gallbladder and bile ducts. So we also are known as HPB for short. We are a specially trained group of general surgeons that tend to manage these diseases in this area. And because the organs in this area is akin to maybe the grand central station of the digestive system, where it comprises a dense and complex network of interchanges. And as you can see in some of my models here, and I will show you shortly. So the group of organs in this area is where the digestive juices such as the bile, the pancreatic enzymes enter the intestines and mix with the food to aid digestion. And therefore, because of the complex anatomy and significant variations of crucial structures in this area, surgery in this area can be challenging and requires a certain level of skill and experience. So going to answer what Michael asked about, what is the gallbladder? So I have a model of a liver here, and this is my right side. So as you can see, this little green organ here is the gallbladder. It's essentially a very small pear-shaped organ in the right upper abdomen, just below the liver. It's connected to the bile duct and it stores the yellowish fluid of bile to help our body digest oily fatty food. So when we eat during a meal, the gallbladder is actually filled up with bile, and it squeezes to help release some of this bile into a tube called the common bile duct here.
Yeah.
So in other words, the gallbladder actually functions as a storage organ, and is thus not essential for life per se, but helps with the digestion of oily fatty food.
So what's in the bile? Is it just fat, or what's actually in there?
That's a good question. So bile is actually liquid produced by the liver. It contains some water, bile acids, and certain proteins that actually help to make it like almost like an engine oil consistency. And this, just like a detergent or something like that, it helps to emulsify or digest, break up the oil and the fat in our body when we eat into smaller particles, so that's easier for absorption. So yeah.
So okay, so you've got this bile in your gallbladder. Yeah. So how does that form into stones, and then what do the stones end up doing that causes problems?
Yeah, so our body is not meant to have stones in any part of our body, I guess. So gallstones are actually pebble-like deposits in the gallbladder, and normally when the bile and the bile acids are present in the body to prevent the gallstones. However, when there's an imbalance of the bile components, gallstones can form either because the gallbladder is unhealthy or overworked, so to speak. And these little crystals of cholesterol or calcium can form over time, and then they start as sand, or what we call sludge, and they accumulate crystals of calcium and they become gallstones. So in Asia, due to lifestyle and dietary habits, actually, unfortunately, we are seeing an increase in gallstones formation. Fortunately, most of the patients are asymptomatic, but for the unlucky ones, gallstones can actually cause a myriad of symptoms such as abdominal pain, infection, and even potentially life-threatening complications such as cholangitis and pancreatitis, depending on where the stone get lodged or blocked.
Okay, so they get lodged in the duct, and it's like forms a kind of a pimple in the abdomen.
Yeah, just an obstruction.
And so what can you do with these gallstones? Can you just dissolve them, or do you have to surgically remove them? And what do you do as a surgeon? Let's say I've got right upper abdominal pain. Actually, let's go back a bit. Let's go back to the diagnosis of gallstones. So let's say I come to you, right upper abdominal pain, a little bit jaundiced. What are you going to do? How are you going to test me?
Okay, so for patients who come and seek attention due to the symptoms because they feel uncomfortable, they have a bit of pain, maybe some bloatedness after oily fatty food or heavy meals, generally we will take a history just to clarify and make sure that the symptoms are not due to something else, which is quite common. Then we may do some blood tests to have a look, and this blood test includes liver function tests to see if the gallbladder or the gallstone is causing any blockage of the liver, and also maybe a full blood count to see if there's any signs of infection. Thereafter, most commonly, we often do an ultrasound, or depending on the situation, maybe even a CT or MRI scan to evaluate the cause of the symptoms. Either ultrasound, CT, or MRI often can tell us if there are gallstones in the gallbladder, or there's evidence that the gallbladder has had previous infection or inflammation, or whether there's any obstruction of the bile duct or the pancreas.
Okay, so let's say you find, so I've got gallstones and I've got some pain. What are you going to do? What are you going to do to me? Am I going to be rushed into hospital? Is it an emergency? Or can we be a bit more relaxed about it?
No, so it depends on the situation. So we generally evaluate patients to whether they have symptomatic gallstones, meaning they have previous episodes of pain, bloatedness, maybe they are becoming more frequent. And this group of patients, we'll counsel them and see if their pain is due to any other conditions, for example, things like stomach ulcers, gastritis. These are also very common conditions in the same profile of patients that can potentially make him or her feel like they're having a gallstone attack. Or on the other spectrum, if the patient had a complication in the past, for example, pancreatitis or gallbladder infection, but has resolved, then these patients would benefit from earlier surgery so that we can prevent the next event, be it an episode of pain or be it an gallbladder or gallstone related complication. Thankfully, most of the patients we see, they come to seek attention quite early. And if they are just symptomatic, but they haven't had a severe attack or do not have an ongoing infection, then the surgery actually is quite elective. The patient will be scheduled. Once other conditions are excluded, they'll be scheduled for an elective surgery, and most of the time this can be done via minimally invasive procedures such as laparoscopic cholecystectomy.
Okay.
And if the patient is fit and well, actually it's a day procedure. Patient can actually go home on the same evening.
Wow. Yep. And is there any non-surgical treatment? What advice do you give to people? Let's say we've got quite mild symptoms, we've got some gallstones. What kind of lifestyle advice do you give to people to try and prevent symptoms?
Okay, so generally once you have symptoms, and if the symptoms after evaluation we assess it or we judge it to be due to the gallstones, then actually this patient would benefit from surgery sooner than later. Because the whole point of the symptoms is maybe you can say it as it's a warning sign, or it's your body telling you that something bad is going to happen soon. Because the best place for the gallbladder or the gallstones to remain in is actually within the gallbladder. Symptoms occur when the gallstones are being squeezed out, or when they get squeezed out and they lodge into an area which obstructs either the pancreas or the liver, and they go on with more severe conditions such as pancreatitis, cholangitis, or things like infection of gallbladder.
I was going to come on to that actually. So those are they're the real risks, is if you get pancreatitis or infection. Does it ever burst, the gallbladder? Does it?
Yeah. So when patients just have symptoms, we still have some time to do the surgery electively. However, if you are lucky, sometimes the first sign of a problem is when the complication has happened. Like Michael, you have alluded to, if the gallbladder gets swollen or distended, the gallbladder can actually swell. It can actually undergo what we call a gangrenous cholecystitis, where the wall of the gallbladder is so thinned out that it's at risk of bursting. And when it perforates, actually, there's a potential for even more serious infections such as peritonitis, where the pus or the dirty fluid in the gallbladder actually goes around the tummy and cause a potential life-threatening or widespread infection. So in that situation, either whether the gallbladder is infected or it has some complications such as gangrene or perforation, then it becomes an emergency surgical condition where we would have to, on top of treating with antibiotics, we have to bring the patient to the operating theater as soon as possible so that we can control the infection and also to get rid of the problem at the same time.
Okay. Now, just to ask you about the actual procedure, you said it's a laparoscopic cholecystectomy, is that right? Yeah. You actually remove the whole gallbladder.
Yeah, we do. So that's a good question. So a lot of patients actually comes to us and they're concerned, and rightfully so, that if God has given me a gallbladder, there must be a function, and can I do without? I heard horror stories from my friends, from my colleagues, that after they remove the gallbladder, actually they get lifelong diarrhea and so on and so forth. So it's a good opportunity to address some of these misconception or misunderstanding. So a laparoscopic cholecystectomy essentially is what we call a keyhole approach to removal of the gallbladder. And some patients also come and ask, can you just remove the gallstones, but not the gallbladder, because I would like to keep my gallbladder? The answer is no, because the gallstones is the manifestation of an unhealthy gallbladder. So if you have gallstones, means actually your gallbladder, for whatever reasons, due to diet, family history, is actually unhealthy or overworked, and therefore, even if you can remove the stones will form again. Secondly, and more importantly, actually removal of the gallstones itself and not taking out the gallbladder is actually more risky and a more complicated procedure. So, over time experience, research, and we know that the best way is actually to remove the gallbladder with the gallstones inside, and this would solve not only the gallstones, but actually the root of the problem, which is an unhealthy gallbladder. So to also add to that, the gallbladder, as we mentioned, is the storage organ. It's not essential for life per se. It's good to have when it's healthy. However, if it's unhealthy or if there's gallstones, then actually the gallbladder is actually what I call a ticking time bomb. Because the gallbladder would eventually or might have a problem, and this can range from about 3 to 5% every year. So if the patient is fit and healthy and the gallbladder has really shown signs of problems, it's better to remove. And because the bile actually still is produced by the liver and it flows into the bile duct, into the small intestine as per normal, so actually patients will not get any problems long term with digestion and they can eat normally. So actually patients would do better if the gallbladder is removed, if we think that the gallbladder is actually symptomatic or causing a problem or has caused a problem in the past.
Okay, so you come in for the surgery. Most of the elective surgery is day case. Yeah. How long does a patient have to stay off work?
Okay, so that's a good question. So if the gallbladder surgery is simple and uncomplicated, it's actually most of us would do it as a day surgery. Of course, this depends on how old the patient is and if they have any other medical problems that might require a day or two of observation. But most of the time, we can do it as a day surgery and patient goes home in the evening. By the time the patient goes home, he's actually almost 80-90% of his normal self. Because of the small wounds and the small incisions, the pain is minimal and often is quite well controlled by simple analgesics such as Panadol or some painkillers. And generally, they can have a normal diet thereafter. In the minority of patients, if they're used to a fatty, oily diet in their normal habits, some of them might get a little bit of loose stools or diarrhea if they eat too oily, fatty food. But usually, over a few weeks, the body will actually get used to the fact that you do not have a gallbladder, and they will go back to normal. So the downtime is minimal. Most patients, if they are doing relatively sedentary office work, for example, and they do not engage in very strenuous activities or exercise in the course of their work, actually they can go back to work the next few days. But generally, we'll give them hospitalization leave or MC for a week or two, just for them to take it easy, for the wounds to heal. And generally, the downtime, I would say, is a couple of days if everything goes well. Yeah.
Oh, that's good. And something I was just thinking there is we do a lot of abdominal ultrasounds for other reasons other than kind of jaundice and pain. Yeah. What happens if somebody has gallstones, but they've not got any symptoms? Do you need to do anything about them?
Yeah. So with the climate of medical treatment, health screening is actually quite a common thing a lot of people do nowadays. So often a lot, they may include scans such as a chest X-ray and an ultrasound, and often the ultrasound do pick up maybe sludge or small sand or stones in the gallbladder. So these patients might, if they seek attention, what we'll advise them, and we'll evaluate through taking history of the diet. If they are truly asymptomatic, meaning that they do not feel any uncomfortable feeling during meals, or they had no previous episodes of what we call biliary colic or gallstone attack, then actually we will advise these patients to just observe and keep an eye out for some of these symptoms, because they may come over time, because the gallstones, if they get pushed out or lodged, these are the things that we would advise them. But generally, in short, if they do not have symptoms, we do not offer the surgery, because even though the surgery is routine, relatively simple, and a day surgery, it has a small risk. So we would advise the patient to watch out for the symptoms of gallstones and not do anything.
Okay. I think we're running out of time here. Is there any kind of last points that we've not covered that you think people should know?
Yeah, so I think it's good to address some of the myths or misconceptions that are out on the internet, or maybe
okay, yeah.
So some of this, one of the very common misconception is that if you read on the internet, you might come across some internet remedies or herbal remedies that gallstones can be dissolved or flushed away, and so on and so forth. This is one of major misconception, because number one, these so-called online remedies are not supported or proven by scientific evidence. Furthermore, they can range from a mixture of olive oil, lemon juice, and many other concoctions. The bottom line is these so-called concoctions do not work, because if you think about it, when gallstones cause a problem, essentially the gallstone gets flushed out, and it's where they get flushed out complications occur. Because even if the concoctions so-called work, because they actually stimulate the contraction of the gallbladder more, the problem is when the gallstones get flushed out, the chances of them getting lodged during the exit process, as you can see here, through this narrow tube and network of tubes, for it to go in the small intestine, is the problem. So when it gets blocked, this is when a major complication might occur. And even if we are lucky that maybe a couple of stones go through, this is also not a good or long-term solution, because as I mentioned, the problem is sorts of, be it a high cholesterol, high bilirubin, or more commonly is an unhealthy gallbladder remains. So gallstones will continue to form because the factory of the gallstones, which is the gallbladder, is still present, and they will still harbor a lifetime chance of symptoms and complications. So the other misconception is some people might confuse gallstones with kidney stones, which is also quite common. And shockwave therapy, or what we call lithotripsy, is commonly used to treat kidney stones, especially when they're small, to break them out and get them to be flushed out the kidney. However, this does not extend to gallstones, because as mentioned, even if the gallstones inside are flushed out or are broken up by ultrasound or shockwave therapy, and true, they may be easier to be squeezed out of the gallbladder, but this is all well and fine if they exit normally. But complications arise when these fragments get stuck during the exit process, and therefore, if I rather have the stone, I have a big stone in the gallbladder that doesn't do anything, instead of breaking up the big stone into 100 smaller pieces that might come out and get blocked.
Okay.
So maybe just to end off our discussion, it's also often misunderstood that medicines or medical therapy is enough to so-called dissolve or treat these gallstones. True, there are medications that can make the bowel a little bit more soluble or more dilute. And this potentially can minimize formation of new stones or dissolve small stones. Unfortunately, they do not work effectively nor consistently. So it's often considered a last resort if, for whatever reason, surgery is not appropriate or safe for the patient. We can prescribe some of these medications to make the bowel a little bit more concentrated, so that maybe they can decrease the rate of stone formation. Other medications can be prescribed depending on the condition. For example, there are pain relievers, or if there's an ongoing infection, antibiotics might help to treat the infection. But at the end of the day, if you have gallstones in your gallbladder is unhealthy, and it's already starting to cause discomfort or has previously caused a complication, the treatment of choice is still what we call a cholecystectomy. And most of the time, thankfully, it can be done laparoscopically or chemo.
Okay, Ser Yee, that was excellent. Thank you very much. I've learned a lot about gallstones. It's been a while since I've listened to anyone talk about gallstones since medical school, probably. Yeah, thank you very much for that.
No, thank you, Michael.
I think we've kind of got to the end of time. I'd like to thank everyone for listening into the video today. And if you've got any questions, you can I'll put Ser Yee's details below the video, so you can contact him directly. Okay.
Okay, thanks, Michael.
Thanks, Ser Yee. Bye-bye.
See you. Bye.